Hello, dear colleagues. My name is Mynzhylky Berdikhojayev. My assistant is Aytelim Rowan. And this is a case number 3 for today. A young lady, 63 years old, with a dural fistula. This fistula is located on the sigmoid and transverse sinuses. Yes, first of all, we are planning to go through the meningeal artery. There is a lot of branches going to the sigmoid sinus, and let's see which part is most active. Okay, patient is suffering from tinnitus, and yes, the tinnitus is the main symptom. We took 7 French guiding catheter. Yes, there is a option 2. It's possible to go transvenosely, but let's check the arterial part. Let's check the arterial part. The access is 8 Frenchies and 7 French guiding Hyperion Judkins right, which is coronary. And the guiding is placed now in external carotid or common carotid. We will check. DAVF один алыш. Okay. The sheath is 7 French. The guiding is 7 French. Judkins right, because the patient is 60-something years old. That's why the arteries could be tortuous. In tortuous anatomy, with the complex access, we prefer to use coronary guiding catheters for better accessibility and support. Yes, the 7 French coronary guiding is less supportive than 8 French, but is more supportive than 6 French. And it allows to use 2 sonic and 1 coiling catheter. Unfortunately, we have no coiling catheter for this case. That's why we will start with the sonic 1.525. It's only size we have today for this case. We are waiting for tenders, and the situation maybe will be better, but till now it's just the beginning of the year. Okay. Наркоз нужен будет очень глубокий. Экран надо будет бақыт экран тартып жіберсеш. Аяғына қарай бір 20 сантиметр тартайық. Картофель. Правда. Все отлично. Okay. The guiding is now in common carotid. The contralateral side and vertebro-basilar system looks normal. No, DAVF, да? Smart mask. Yes, we have 2 branches. One branch is this one. I'm not sure which one is this, but it's look like the maxillary artery. Okay, let's check. Промывка нематопхозпоясанс. Промывная система нематопхозпоясанс. Света, убери, пожалуйста, манжетку от интубационной трубки. Манжетка в поле зрения лежит. Надо убрать ее.
А, манжетка
Да.
сейчас.
На грудь надо положить. Все, да? Окей. Спасибо. Рахмет. Рахмет is a thank you. I think it's a meningeal territory. It's a meningeal artery. Okay. Let's check the angiography. Yes, there is a spasm, it's better. Stop. Вперед, stop. Stop. It's not the meningeal, it's a branch of the meningeal. Okay, it goes a little bit more correct. It's a small branch, but we need to go to the main branch. Okay. I don't know what happens. It goes to the branch. Okay, now we are in the territory. Okay. Let's check. Okay, let's rotate it. И несколько изосал на тиске криминала. We are planning to go to this branch. Yes, we give a little bit J to go to this branch. Yes, yes, yes. My next slow from there. Yes. 160. Yes, we will start with the catheter was Sonic 1.525. It's only available size in the department at this present time. I think there is also some branches coming from the below. Let's check it. Контраст выброс. Так, наркоз, обезболить сделали, да? Сейчас будет больно. Yes, it's a control check before the injection because it's very painful and радиация некий весел. This is a Manox 18. There is a branches coming, and I think now we could be inside the sinus. Let's look like the sinus. Nope. Stop. No, референтка это слышишь? Последний пустой классал. It looks like sinus. We may occlude the sinus. I think it's no problem. I think this is inside the sinus. It's an isolated sinus with a retrograde drainage. Or it might be parallel sinus. Сквитоник линейр. here. Yes, the alternative could be the recanalization. At this point, I think there is another fistula. Yeah? Maybe the venous approach is better for this part. We should use this one, but it's possible to come with venous approach and isolate this part. Okay, we should try to preserve this part. Yes. Maybe we'll use the transvenous approach because that part is quite distal. Okay, I think we'll now start occluding the sigmoid sinus. Yes, start to go there. Is that? No. Stop. Okay, it's good. We started with Menox 18, now we'll follow with Squid 12. Yes, maybe we will occlude this isolated sinus. Okay. So one more time. Гепарин салсасныш? Бесми. Бесми. Now we're asking for heparin 5000. Okay. Smart mosque. Предыдущий коржик. Okay, let's compare which part is occluding. This one is this one. It looks like something is here, this one, or it's a vein, no? It might be the vein. Okay. That's it. Вперед, вперед. Вперед, 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 вперед. Okay. Smart mask. Спасибо. Рахмет. Смарт мозг. Родно. All is going backward, huh? All is going back. Okay, let's wait. Let's wait. Kaldık Linux Geneser. Вообще, новый наш трассаң болады, Linux 18-дің. Я екеуінде. Остатки и новый. Yes, I'm asking Rowan to take 18, which is Linux. Okay, it's still there. Now we are including the transverse sinus. I think this sinus is non-functional. Some part is still going there, some part is going here and draining here. It's not like this jugular is partially functional. Ready? Ready? Yes, it goes backward. Backward. Okay. Let's change the settings. Нағам қайтын қойып тастайсың. 12-шіне қойып тастайсың. Денесің. Тоже ішіне қойып тастайсың, сосын егер керек болса денеміз. Okay, let's wait for 1 minute and then we can start inject Linux 18. Maybe some branches is still arriving here, which is something like there, and some branches is still coming to this point. And I don't want to go from those branches. There is one more branch coming from here. Okay. The alternative is full reconstruction of the sinus with stenting, with angioplasty, but the sinus occlusion is also the option. That's why if it's possible to occlude, let's occlude. Okay. And we didn't see the lab bay. Lab bay is already occluded. Okay, let's check the lab bay. Let's see the lab bay. Lab bay is not here. Something is coming. It's a contralateral set. There is no lab. Now we will occlude this point and then we can go retrograde, and we can occlude this part. Я раду. Okay. Now we can wait a little bit more. And then we isolated the sigmoid sinus, and we should occlude that part. Huh? Okay. Вперед, назад, вперед. Ладно. Okay, let's wait a little bit. Okay, let's wait. It might be the orifice of some veins from the occipital, temporal occipital part. Назад. Вот. Назад. 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 Стоп. Вперед. Вперед. Стоп. Okay. Let's look like this. Okay. Родно. Okay, let's wait a little bit. Ветковый коррегиптурный жовтый. Она ветковый коррегиптурный жовтый. It might be a little bit functional branch, that's why I'm not sure those branches. It might be a little bit functional, but this might go to the territory. One of this one or this one. Let's see. If it's needed, we can go there. But it's better to occlude it from here to here. Okay, now it's going to the correct direction. Let's wait a little bit. It's going to the correct direction. Now we isolated the vein. Yeah? It looks like we tried to isolate the vein. Okay. It's going to stop. We can inject a little bit more. Okay. You can inject a little bit more and then finish. Okay. I hope the brain part will be okay. This sinus was useless and was used mostly for the dural fistula. Her ekstra bir koyarsın. Şurada. I think it's a point. It's a point we should stop. Yes, we can stop at this point. It's a single sonic microcatheter. Okay. Finished. Okay. Okay. Let's decrease the radiation and let's zoom. Yes. Everything is stopped at the sinus. There is no more. Yes, it's okay. Yes, the brain is clear. Let's check the venous system. Yes, everything is okay. Now we can finish the injection and I will ask Rowan to do control. Okay. Dear colleagues, expert CT is ready. It's a protocol. The posterior fossa is clear, middle fossa is clear, everything is clear. Okay. Yes, everything is clear. Thank you for watching. The next case is IC aneurysm after partially embolization in different institution. We will do under local anesthesia. We'll check, and then if it's needed, we'll place a flow diverter stent. And after that, we have one more ACOM aneurysm, one ACA aneurysm, one angiofibromatosis in oral cavity, oral nasal cavity, and okay, we'll see. Thank you. See you in 20 minutes.